Mount Sinai instilled in me a standard of academic excellence, that you're not going to settle for the simplest answer. You're going to try to contribute to the literature. That is genuinely an expectation there. It was great to come there early in my training as a fellow in infectious diseases, and more importantly over the years at Elmhurst. This is such a unique hospital. What happened quickly in the early 1980s is the AIDS epidemic hit particularly hard in New York City. And the number of AIDS patients grew very, very quickly. And that was just as I began as an attending at Elmhurst. So it transformed our specialty into very much a primary care specialty.
Joe Masci, through his leadership of the Global Health Institute and the Division of Infectious Disease at the Elmhurst Hospital Center, has had a major impact on the lives of patients in New York City and beyond. He is an international expert in serious infectious disease, such as HIV. Most recently, he has played the leadership role in preparing New York City for potential Ebola outbreaks.
Many of us who work in HIV areas have been touched by the connections we've had with our patients.
AIDS is stereotyping, stigmatizing, and alienating. And so what Dr. Masci did was to actively listen to his patients and the community. And then he used what they said in how he actually delivered evidence-based care.
The program is now considered one of the best in the United States, and we're now looking at an end of AIDS strategy.
Dr. Masci's influence on me is really unmeasurable. I remember being an intern and a resident, and we would go to morning report, and Dr. Masci would hear about the cases of the admissions from the night before. And often he would come up with diagnoses that none of us had thought of. He's able to transmit something that the textbooks can't, and that's that lived experience of what it's like to manage these complex infections.
Infectious diseases is a very important specialty globally now. There are many, many subpopulations, not only in terms of how they look and language, etc., but in the diseases that they get. And in this community, which is the most ethnically diverse square mile on Earth, we are looking for strategies to try to tease out some of these differences and how diseases manifest themselves, how the emotional impact of disease may be different. When I heard I was going to get the Jacobi Medallion, I was very moved. As a teacher, it's such an honor. I think what I would want people to take away from my words is a recognition that connecting with patients is really the centerpiece of what we do.